Respiratory infections are a group of infections that primarily affect the respiratory system, which includes the lungs, airways, and breathing passages. These infections can be caused by various pathogens, including viruses, bacteria, fungi, and other microorganisms. Respiratory infections can range from mild illnesses to severe respiratory conditions. Here are some common respiratory infections. Pneumonia. Pneumonia is an infection that causes inflammation in the air sacs of the lungs. It can be caused by viruses, bacteria, fungi, or other microorganisms. Pneumonia often leads to symptoms such as cough, fever, chest pain, difficulty breathing, and fatigue. The severity of pneumonia can vary, and it can be particularly dangerous for young children, older adults, and individuals with weakened immune systems. Influenza, flu, is a viral infection that affects the nose, throat, and lungs. It is caused by influenza viruses and can lead to symptoms such as fever, cough, sore throat, body aches, headache, and fatigue. In severe cases, the flu can result in complications such as pneumonia. Seasonal flu vaccines are available to help prevent influenza and its potential complications. Common cold. The common cold is a viral infection of the upper respiratory tract caused by different types of viruses, most commonly rhinoviruses. It is characterized by symptoms like a runny or stuffy nose, sneezing, sore throat, cough, and mild fatigue. While a cold is usually a mild illness, it can still cause discomfort and may lead to complications in certain individuals, such as those with weakened immune systems. Bronchitis is an inflammation of the bronchial tubes, which are the air passages that carry air to the lungs. It can be caused by viruses, bacteria, or exposure to irritants such as tobacco smoke. Acute bronchitis is often viral and typically resolves within a few weeks, while chronic bronchitis is a long-term condition associated with smoking and can lead to chronic obstructive pulmonary disease, COPD. Prevention and management of respiratory infections include practicing good respiratory hygiene, such as covering your mouth and nose when coughing or sneezing, regular hand washing, avoiding close contact with infected individuals, and staying up to date with relevant vaccinations like the flu vaccine. Treatment options for respiratory infections depend on the specific pathogen and the severity of symptoms and may involve rest, fluids, over-the-counter medications for symptom relief, and in some cases, antiviral or antibiotic medications. It's important to note that specific respiratory infections may have different characteristics, treatments, and preventive measures. If you suspect you have a respiratory infection or have concerns about your symptoms, it is recommended to consult with a healthcare professional for an accurate diagnosis and appropriate treatment.